Okay, good evening, everybody. I want to introduce myself. I'm Dr. Lucy Wilson. I'm the health officer for Baltimore County. And today we're having a information session on measles. And we're fortunate to have a speaker today who is Dr. Greg Giussani. And he is the director of the Baltimore County Health Department's Bureau of Communicable Disease and Environmental Health Services. So he's going to speak today. He's going to be sharing slides and wear his backup if he has any slide problems. So thank you. What I would like to do is please have people mute yourselves if you are on the WebEx. There'll be time for questions. What we'd like to do is have Dr. Giussani present and then answer questions. There are different ways that you can ask your questions. That includes raising your WebEx hand. You can find that icon on down at the bottom. There's a little hand and it says raise. You can type a question into the chat. And then if we notice that there's anyone on by telephone, it's really hard to raise your hand or put anything in the chat if you're on the phone. And so we'll just unmute and make it so people at the end can have their questions asked and answered. And then at the end, if there's a question that you have that wasn't answered or you think of another question, we'll put up some contact information so that you can email. So that's all I can think of. If somebody accidentally unmutes, we may take the liberty of muting you if it's noisy, but you're welcome to ask questions at any time or at the end. Anything else I didn't think of, Dr. Giussani?
I can't remember if you said it or not, but this meeting is going to be recorded. So for those of you on, just be aware we are going to record it just so we can share it more broadly after the fact for those who weren't able to attend tonight. But just for everyone's awareness. And I think Tina was recording that. I'm not sure if the recording started yet or not, but it will be soon.
I believe it has started. So
okay, perfect.
Okay, so I'm going to mute myself, and you have slides to share, right?
I do, yes. I'm going to try and share them right now on WebEx. If not, you see my slides?
Yes.
And you can just see the first one, right?
Now we can. Yeah, now
it's
on the screen. Okay.
Perfect.
Great.
All I can see are my slides. I can't see the videos or the people's videos on the sides or anything. So if somebody is actually raising their hand, if someone could just say something so I know to stop and address that, I would appreciate it. But otherwise, I'll go ahead and get started. So first off, good evening, everyone. Thank you for taking the time out of your evening to come be here with us and to learn more about measles. Like Dr. Wilson said, my name is Greg Giussani. I'm the Bureau Director for the Bureau of Communicable Disease and Environmental Health Services. I'm also a physician myself. Prior to joining the health department, I worked as an emergency medicine physician with the University of Maryland School of Medicine and work clinically with some of the sites that they staff. So very excited to be here. This is a topic that, you know, we're seeing more and more of both locally and certainly nationally. And this is something that is coming into our hospitals more. And so we wanted to take the opportunity to talk to you more about it tonight to hopefully lead to more understanding and maybe clear up some of the misconceptions that are out there about this disease. So I'm going to go ahead and get started. My objectives for tonight, I have three broad objectives that I hope we can all meet and walk away from. The first is I want us to discuss trends in measles cases, both locally here in the state of Maryland and more broadly in the country at large. And, you know, this is a topic that's been in the news a lot recently. It's something that I'm sure a lot of us have some familiarity with, but I'm going to try and dive into the numbers a little bit. Because I am a physician, no talk would be complete without discussing the signs and symptoms of the disease, something that, again, you know, when I practice clinically, something that we think a lot about and look for, but also very important for you all to know as well, to know when yourself or someone you know might be exhibiting some of the classic signs and when to seek evaluation for that. And we'll also talk about some of the therapies that exist out there and some of the remedies that have been proposed as treatment for measles, and we'll discuss some of the evidence behind some of those as well. And so, again, given my role in the county health department, I just want to say I have no financial disclosures for the purposes of this talk. So let's start with, what is measles broadly? Again, this is something that has been in the news a lot recently. I'm sure people have seen it, read about it, but let's talk broadly about what it is. So measles is a virus. It's not a bacteria. It's not a fungi. It is a virus. And because of that, that impacts how we treat it. Things like antibiotics, which only work for bacteria, don't really have a role in the treatment of measles. They simply antibiotics simply wouldn't work for that. And we'll talk later about what the therapies and treatments are. It's spread by the airborne route, and what that means is when someone speaks, coughs, sneezes, whatever the case may be, the virus particles go out into the air and they hang in the air for someone else to kind of breathe in and then get infected themselves. You can also get it from contact with an infected surface. So if someone sneezes on a table and you touch that and then touch your mouth, that's a way for it to be transmitted as well. Typically, there have been studies that show the virus can last in the air for up to 2 hours after it's kind of expulsed into that. So even if you're not in the same room as the person, at the same time, I should say, as the person with measles, you could still potentially be infected depending on how soon after you enter the space that they were in. And one thing to note, and this has also been in the news a lot recently, is that measles was actually declared eliminated in the United States in the year 2000. And I think it's important to pause here to talk about what that means, because this is one of those cases where the scientific meaning for the word eliminated and the common usage of the word eliminated don't exactly match. And so when you see something like that, you might think, oh, it's eliminated. That means hasn't been a single case in the United States since the year 2000. And that's actually not the case. There have been cases in the United States since then, albeit to a much smaller degree. What the World Health Organization means when they say that a disease is eliminated, and certainly in the case of measles, is that there's been no person-to-person spread of the disease in the United States within a certain time frame. So while there have been cases, they haven't been linked to one another. One person didn't give it to another person who then gave it to another person. These were all separate cases, usually related to international travel. And there's actually concern that the United States might lose this designation from the World Health Organization because of the current outbreak that we find ourselves in. But we'll talk more about that. And so I'm sure we've seen a lot of scary numbers on the news about caseloads and how they're going up, but I just throw this graph up there to put some things in perspective. And what I want to show here is that before the vaccine was introduced, there were a lot of cases annually in the United States, close to 500,000, which we'll get into the numbers in just a bit, but we are nowhere near, and hopefully we'll never come close to that level. And if you look at that graph, it looks like we're at zero, for a while there, and we're not. And again, we'll talk about the numbers, but the reason it looks like it's zero is because the graph, the numbers on the right, or on the left, excuse me, are so big because we used to have so many cases every year in this country. And because of the introduction of vaccines, because of other advances in public health, we've really made significant progress in decreasing the amount of cases that we see every year. And we'll talk in a little bit about, one, how contagious measles is, and two, some of the complications that really add to the health burden of this disease. And so current trends, so I've just gave you a little bit of historical context about where cases were, but let's talk about where we are now on May 21st, 2025. So national trends, these numbers here, I checked the CDC website this morning when I was finalizing these slides. And so these numbers were as of about 10 a.m. on the CDC website. They may have changed since then if they updated them this afternoon. But this morning, at least, there were a little over 1,000 cases across the country of measles that have been reported to health departments in various jurisdictions. This has affected 30 states and has led to 14 formal outbreaks. And again, to kind of go over what outbreak means, outbreak in this sense, in the public health sense, means 3 cases that are linked together. And so you have to be able to kind of not definitively prove, but show that one person infected another person who infected another person, or one person infected two other people. Not every case of measles is an outbreak if the cases aren't related, or if the one case doesn't lead to other cases. But so far, there have been 14 outbreaks reported across the nation. To give some context, in 2024, for all of 2024, there were 285 cases total across the country, and there were 16 outbreaks. So we're roughly where we were in terms of number of outbreaks, but you can tell that the number of cases is vastly increased this year compared to 2024. And so again, looking at the national trends, 96% of the cases that have been reported are in unvaccinated individuals, primarily in children. 13% of those, a little over 1 in 10 of the cases, have required hospitalization for various reasons, and we'll talk about some of the complications in a little bit. And it's led to unfortunately, three deaths, primarily in the Southwest, where a lot of these cases are concentrated. I think it's 2 children and 1 adult who have succumbed to this. The graph on the right just shows the percentage of by age group of who's required hospitalization between 2024 and 2025. Although by and large, the percentages, I should say, who have required hospitalization are less, you can see that the burden primarily falls in children who are under the age of 5 years old. And again, a little later on, we'll talk about why they are at higher risk for complications and hospitalization. So let's talk about Maryland. Let's talk, because this is obviously the state where we all work and live. And obviously, it's one thing to talk nationally, but it's another thing to know what's going on in your backyard. And so measles in Maryland, thankfully, we're doing better than the country at large. So far, there have been 3 cases that have been reported in Maryland. And actually, none of them, fortunately, are in Baltimore County, and hopefully it stays that way. There's been 1 case reported in Howard County and 2 in PG County. There have been no outbreaks. These 3 cases, insofar as we can tell, are not related. Although all of the cases have had recent international travel, which we suspect is what caused these individuals to contract measles. Unfortunately, there have been 0 deaths in the state of Maryland so far due to measles. And again, compared to the rest of the country, these numbers are obviously great. Hopefully, these numbers continue to hold, and that's our hope. Obviously, at the health department, I'm sure it's the hope of a lot of other people at a lot of other health departments as well. So now that we know kind of the current status of measles, both, in our home state and the country at large, let's talk about some of the signs and symptoms of measles. So before we get into that, measles is one of the most contagious viruses out there. I was looking in the run up to this talk to see if I could find anywhere that kind of ranked it compared to the other virus, and I couldn't find anything that said it's the most contagious virus or the 3rd most contagious virus. I don't know if any such ranking exists, but suffice it to say, it is very contagious. One person who has measles, studies have shown, can infect anywhere from 12 to 18 people. And 90% of susceptible individuals who come into contact with someone with measles will become infected. So to put that into perspective, if I have measles and there are 10 of you on this Zoom call, or if we happen to be in the same room, only 1 of you would walk out of that room without having contracted measles if you were otherwise susceptible. And we'll talk about what that means in a little bit. So talking about the incubation period, and what we mean by that when we're talking about disease is the time between when you contract a virus, when you breathe, in the case of measles, breathe it in, and when do you start showing symptoms. And measles actually has a pretty long incubation period. It's anywhere from 11 to 12 days, so almost 2 weeks. And I want to point this out to really highlight, if heaven forbid you ever contract measles and we have to call you in our role at the health department, we're going to ask you a lot of questions about kind of, the 2 weeks roughly before you started showing symptoms. That's not because we're nosy. It's not because we want to know everything about your personal life, but it's because in trying to figure out how you could have contracted it, we need to go back that far to figure out what your exposure history was and who potentially could have given it to you. So again, it might seem tedious, it might seem unnecessary, but there are reasons when we call and ask these sorts of questions that we're doing it. And in measles, like I said, we're going to have to go back about 2 weeks back into, your history, what you were doing, who you were with, to try and figure out how you got it. You're infectious for about 4 days after you develop kind of the classic rash associated with measles. And again, we'll talk about what that looks like in a few slides here. Oh, thought I slipped. So moving on to symptoms. Before you develop kind of the classic rash, and again, we'll get to that in a sec, you're going to have these prodromal symptoms, or kind of pre-classic sign symptoms. And really, these prodromal symptoms are very non-specific. Fever, cough, coryza, which is kind of a medical term for a runny nose, and conjunctivitis, which is a medical term for red, kind of watery eyes. The reason I use the medical terms there is, when I was learning about this disease, we love mnemonics, and so we always talked about the 3 C's of measles: cough, coryza, and conjunctivitis. It was a little mnemonic we used to kind of help us remember these things. But again, I want to point out these symptoms, nothing about them really screams measles. Especially during cold and flu season, a lot of these symptoms at this stage are probably going to be attributed to kind of a cold flu type thing, as opposed to obviously measles. And so in this phase, actually, a lot of times the disease is missed because, healthcare providers aren't always thinking about measles, because up until recently, we weren't really seeing lots of cases of it. And again, thankfully in Maryland, we're still not. But this is kind of the harbinger, the first signs you're going to develop after that 11 to 12 days have passed after your exposure. But again, nothing really there that's going to jump out at us in the healthcare field that you're infected with measles. Moving on, though, you are going to start to develop some of these more quote unquote classic symptoms, or things to us in the healthcare field that are more indicative of a measles infection and would probably prompt us to dig a little deeper and order those tests. About 2 to 3 days after you develop kind of those cold and flu symptoms, you can develop what are called Koplik spots. They're white spots kind of on the inside of the mouth, and I'll show pictures of that. But really, the real classic symptom, the symptom that, again, in medical school we're all taught is the sign we look for when we think of measles, is this rash. Typically develops 3 to 5 days after the cold and flu symptoms that you have, begins on your face and spreads down to the body. And that's also the order in which it disappears. Starts on the face, goes down, and then face down to disappear as well. This right here is a picture of the Koplik spots. You can see these kind of white spots on the inside of the mouth. Again, if there were no other symptoms to go along with this, you might think, oh, that's just a cold sore or something like that. But in someone who's having these other prodromal symptoms, will kind of lead some of us in the healthcare field to really stop and think, could this be something more? Could this be measles? And certainly if we see this rash, we are going to be thinking measles, especially, the way things are right now, seeing the cases go up. This is a kid who already has the rash. It's already spread from the head on down. Kind of this red blotchy rash. You can see no blisters. You shouldn't see anything like that. And one thing to be aware of is this rash isn't going to be itchy. It looks like it should be. It looks like it should be causing a lot of kind of discomfort and itchiness, but really it shouldn't be. And this is one of the things we look for when we're trying to differentiate. Could this be a measles rash versus could this be something else like chicken pox or a drug reaction or even a really bad case of allergies? Is the kid, or is the patient, I should say, excuse me, experiencing any itchiness or things like that? So in terms of the course of the illness, once you've got it, what can you kind of expect in terms of time course? So once you develop the rash, that's going to last about 5 to 6 days. And once that kind of starts to clear up, assuming you don't have any of the complications from measles, you'll probably start to feel better as well and kind of recover from those symptoms. In terms of when you're infectious, meaning you can pass the virus on to other people 4 days before and 4 days after the appearance of that rash on your body. And so again, I highlight this because if you ever contract measles and we call you, we are going to ask what you were doing the 4 days before the rash appeared. Again, it's not because we're trying to be nosy or know everything about your personal life, but we're trying to figure out who else might have been exposed so we can warn them, get them in for testing, and hopefully get them before they infect other people. And again, the reason why this is problematic that you're infectious 4 days before the rash is, like I said earlier, before the rash, before the spots in the mouth, a lot of the symptoms with measles really don't scream measles. They scream more kind of cold flu, the cough, the runny nose, the runny, watery eyes. If your healthcare provider isn't thinking measles, and again, very reasonable that they might not be before the rash appears, they might not know to advise you that you need to stay home and limit your contact with others. And so in those 4 days before the rash appears, you could spread measles to a lot of people. And remember from earlier how infectious this is. And so if we're able, in talking to you, to talk to people that you've potentially exposed, we can get them into quarantine and avoiding contact with people earlier on in this process, and hopefully limit the spread of the virus. And kind of on that note, if someone does have measles, we do recommend isolation for these 8 days, the 4 days before and 4 days after the rash. But again, recognizing that a lot of these cases are caught only after the rash appears. So it's the 4 days after the rash appears. After that, after those 4 days have passed, typically people are able to return to school, to work, whatever the case may be. The good news is the vast majority of patients who contract measles will recover with no long-term complications. Unfortunately, there are complications, and we need to discuss what those are. The most common complication from measles is developing a pneumonia, an infection of the lung, and there's kind of some different thoughts as to what causes this. Usually, it's the virus damaging the lung and making it more susceptible to infection through kind of inflammation and scarring in the lung. That pneumonia can be caused by the measles virus itself, or it can make the lung more susceptible to other bacteria to come in and then cause a pneumonia. This is the most common cause of death in patients who have measles. This is often why they die, and it's particularly an elevated risk for children. It's the most common cause of death or mortality in kids under the age of 5. So something to be aware of. Another less common, though scarier complication is something called acute disseminated encephalomyelitis. And what this is when your immune system, kind of ramps up to fight the measles virus, it goes too far and it actually starts attacking the nerve cells in your brain. It can lead to seizures. It can lead to paralysis in extreme cases. There's no cure per se. Once it's diagnosed, we give medicines to try and kind of stop the immune system so that it stops attacking the brain. In cases like this, when it's caught early and the kind of therapy can be initiated, about 50 to 70% of those patients will recover with no long-term disability. Perhaps the scariest complication of measles, though, is what's called subacute sclerosing panencephalitis. This is caused by the measles virus actually getting into the cells of the brain, and kind of what it does is not completely understood. Basically, though, it causes inflammation of the brain tissue and eventual death of that brain tissue. This is a complication that in many cases in most cases actually doesn't really kind of become apparent until years after the infection. sometimes up to 7 years, I think is the average for between when someone is infected and when they start to develop symptoms of this disease. It typically starts with kind of changes in behavior. Individuals become more aggressive, less or more emotionally labile. It eventually progresses to, again, things like paralysis, seizures, blindness, and ultimately death. And unfortunately, there is no cure for this. If once you develop it, there's really nothing in the medical field that we can do to reverse that. And there's no rhyme or reason that we've found yet as to why some people develop this complication and some people don't. Um, and I'm sorry, I forgot to give numbers earlier. For acute disseminated encephalomyelitis, about 1 in 1,000 individuals who have measles will develop this complication. For subacute sclerosing panencephalitis, it's about 2 in 10,000. Although I should note one study in 2016 found that about 1 in 600 kids who were less than 15 months old who were unvaccinated developed this condition, which again didn't manifest until years after the fact. But once it does, unfortunately, there's really not a lot that can be done for the people who develop that, unfortunately. And measles overall, through a combination of all of its complications, but primarily its pneumonia, about 1 to 3 of every 1,000 people who get measles will die. And you can see, we've had about 1,000 cases. We've had 3 deaths so far in the country, and so those numbers, unfortunately, are holding steady for us in the current outbreak that we're in. So, who are the high risk groups for having complications for measles? Well, according to the CDC, it's really 4 groups that we think about: children under the age of 5 years old, adults over the age of 20, any woman who is pregnant, and anyone who's immunocompromised for whatever reason, either through lack of a fully functioning immune system or someone who's on some sort of immunosuppressing medication for a medical condition. I will say, in the children under 5-year-old category, the group that we kind of worry about the most are the children under the age of 12 months. These are children who, in general, have very weakened immune systems, which is why a lot of vaccines can't be given until the age of 12 months. And, these children also haven't received any measles vaccination. We'll go over the vaccine schedule in a second, but any child under the 12 months of age, aside from maybe some immunity they'll get through drinking breast milk and getting antibodies that way, really have no inherent immune system ability to combat measles if they get it. And so while the CDC says children under 5 years old in general, we really worry about the youngest in that group, meaning the less than a year old. And so what are the
more likely.
Sorry, did someone have something to say? No. Okay. Continuing on. So let's talk about treatment for measles. So if you get measles, really there's no cure. Like I said, the vast majority of patients who contract measles will recover within that kind of 2-week time frame, give or take. But again, not everybody will, and there are some very serious and potentially fatal complications that go along with it. And so measles is something that if we can prevent people from getting it, on the public health side, we really strive to do. And the most effective way to do that is the MMR vaccine. MMR stands for measles, mumps, rubella. It's a vaccine that actually provides protection against those 3 diseases. Mumps and rubella are 2 other diseases that had previously been common, primarily in childhood, but thanks to increasing vaccination rates, are seen much less frequently now. It's a 2-shot series. Getting 1 shot provides about 93% protection. 2 shots, if you've gotten both shots, gives you about 97% infection, which doesn't get much better than that when we think about public health and immunity from disease. So who should get vaccinated? The CDC recommends 2 doses of the MMR vaccine, excuse me. If you're following the routine recommended vaccine schedule, you get your first dose as a child in the 12 to 15 month age range, and then you get a second dose between the ages of 4 and 6. The other group who should get it who are adults, any adult, anyone kind of any adult without evidence of immunity, and we'll talk about what that means in a little bit. And so what does evidence of immunity mean? Well, if you've received 2 doses of vaccine, either as part of your routine childhood vaccinations or later in life, you're considered immune just based on how effective this vaccine is known to be. If you have lab evidence of immunity, you can draw what are called titers to check that your immune system has made antibodies based on receiving the vaccine. So that counts. If you have lab evidence of having had the infection in the past, similar checks the immune system, but checks slightly different things, you're considered immune as well, because once you've gotten it, your immune system will recognize it in the future, and that'll prevent you from becoming infected again. Or if you were born before 1957, the reason is this was kind of before we had the MMR vaccine. Given how contagious measles was and how prevalent it was, it's just assumed that anyone born before this time has been exposed to the virus, has been infected by it, and now presumably has immunity to it. So it's summertime. A lot of us are planning, fun trips abroad, although sadly I am not one of them. I will not be going abroad this summer. But to those of you who are, 1, I am very jealous. But 2, I think it's worth talking about some of the guidelines around international travel, because while in the US we've seen a significant drop in cases due to vaccination rates, unfortunately, the rest of the world and certainly some of the lower income countries haven't had the same access to that vaccine and haven't had the same level of success at curtailing its rate in its population. I will say too, a lot of the cases that we're seeing in the country are from international travel to kind of areas where measles is more prevalent. All 3 cases in Maryland have been, and a lot of the cases throughout the country have also been, although there has been some domestic person-to-person spread now too. So if you are traveling abroad, you should do everything within your power to try and get vaccinated 2 weeks before leaving. That gives your immune system time to recognize the virus and build up your immunity before you get on that plane and go wherever you're going. If you have a child who's under the age of 12 months, they can get an early dose between 6 months to 11 months. Again, if you're going abroad, this is not routinely recommended unless you were traveling to an area where measles is known to be prevalent. That getting that dose slightly early doesn't change anything. It doesn't mean your child will have to get that second shot any earlier. It doesn't mean they'll have to get more than the 2 shots. They just get the first dose early. They develop that immunity, and then you follow the normal schedule. So they'll get their second dose at around the 4 to 6 year mark. If your kid is over the age of a year but hasn't been vaccinated for whatever reason, you should get their first dose immediately, and then their second dose 28 days later. And this is for any kid or adult, really just anyone over the age of 1 year old. Getting the 2 doses gives you that 97% is more effective. And certainly that extra protection is going to be something that I would imagine you would want if you're going into an area where measles is much more prevalent. So I want to talk a little bit about vitamin A. And the reason is it's been in the news a lot recently. It's been presented and, maybe even promoted as kind of as a cure for measles and as potentially an alternative to the MMR vaccine. And so I want to talk about some of the data that is leading people to make those claims. So I will admit there are some studies that show that vitamin A supplementation has benefit for patients who have contracted measles. The big caveat with that is that all of those studies that have been done have been in low-income countries where, due to lack of access to adequate nutrition, large segments of the population are vitamin A deficient, kind of at baseline. So vitamin A does have a role in your immune system. And so giving people who have low levels of vitamin A or are deficient in vitamin A, vitamin A supplementation, the thought is that it'll boost their immune system and help it combat the measles virus. And again, in those countries, there has been some evidence that that works. But again, that's the caveat to these studies that are often cited showing benefit, is that they've all been done in these low-income countries. Vitamin A deficiency in the United States, again, due to better access to food and nutrition, is very, very, very rare. It's rarely seen. And so there hasn't been any study or any sort of clinical trial in the United States in individuals who are not vitamin A deficient that has shown any benefit in, combating measles, recovering from measles, or really any other disease, any other viral or bacterial infection. And actually, vitamin A, taking too much of it can actually cause significant harm. Vitamin A is a vitamin, yes, but you can actually take too much of it and you can have what's called vitamin A toxicity if your levels are too high. And so some of the symptoms of vitamin A toxicity are headache, nausea, vomiting. You can feel dizzy. You can get this dry, cracked skin, or it can even kind of crack your lips. None of that sounds fun, but more alarmingly, vitamin A can also damage your liver, and in extreme cases can lead to liver failure if you take too much of it or take too much of it too quickly. And in pregnant women, vitamin A toxicity has been linked to birth defects, primarily around the formation of the spinal cord. And so again, if you're deficient in vitamin A, by all means, that's something that's potentially a therapy worth exploring. But I'm willing to bet most, if not all of us on this call, and maybe even in the country, are not vitamin A deficient. And the risk we take in taking the supplementation is taking too much of it and kind of pushing us into this toxic range. The reason I have this picture up of cod liver oil is, one, cod liver oil is a very popular supplement and is often, kind of touted as this natural source of vitamin A. And it's even marketed to kids. You can see this bottle is for kids. It's got like the fun brightly colored fish on the side. And again, it's something that should be done with caution, because you don't want to give your kid, and you certainly don't want to give yourself, too much vitamin A and risk some of these side effects. There have been cases domestically of vitamin A of primarily children who have had to be hospitalized for vitamin A toxicity and to recover from some of the effects of that. I tried to find some numbers for this talk. I couldn't. I just found anecdotal stories in the news, but I cannot find any hard numbers about how many people this has affected. But it is something that unfortunately we're seeing. And again, people, I hope, if nothing else, you walk away from this talk with a better understanding of what the evidence around that is, and why vitamin A, again, it has a role globally, but domestically it's going to be of limited value when it comes to combating this current measles epidemic. The MMR vaccine and kind of identifying those cases early and isolating them is going to be the best thing for us in terms of limiting the spread of this disease. So, final thoughts that I have is that measles is highly contagious. It has some incredibly scary and potentially fatal side effects and consequences. Vaccination is the best protection for you and everyone around you, given how contagious this virus is. And again, before you try any alternative therapies or treatments that are being pushed out there, please just talk to your healthcare provider about it. They can talk to you about kind of what the evidence is and help you make that informed decision. One thing I do want to say in closing is that the Department of Health will be having an adult measles vaccine clinic at St. Joe's Parish. That's tomorrow from 3:30 to 7. The address is up there. I'll leave it up there for a few minutes for anyone who's interested. If they want to jot down the address, I'll be out there with some members of my team. This is for adults, and we define that as age 19 or older. But if you're able, if you're unvaccinated and want to get vaccinated, please, please, please come out, see us, talk to us. We are more than happy to talk to you about the benefits of the vaccine. And again, if you're so interested, to administer that vaccine to you, which, we cannot emphasize enough how important that is for not just your health, but again, the health of everyone around you. So thank you everyone for taking the time out of your evening. We really appreciate it here at the health department. That's my email down there. If anybody has a question or wants to connect with me offline, I'm happy to chat. But I'll turn it over now for if anyone has any questions. And I'm going to stop sharing my screen so I can see all of your faces again.
Great. Thank you, Dr. Jasani. So we'll open it up for questions. I'm just looking. I don't see that anyone is on via telephone. So I think we're good in that way in terms of people either raising their real hand if their video is on, putting up a yellow raise hand, or putting something in the chat. So we're open for questions. Yes, I see Sue Murphy has her hand up.
Can you hear me?
Yes.
Okay. The prodromal fever, is that usually a low grade one or a higher one?
That's an excellent question. My understanding is that it's a higher one. But, and I'm sorry, when you say low grade, what do you mean?
100,
less than 100?
or is it 104,
Yeah. No, that's fair. My understanding is that it's high grade, but I'm not sure. I can look that up and let you know if you want to message me your email.
It's not, I can look, no, that's fine. I can look it up. It's not, no, don't take your time on that.
Yeah, I mean, I think it can be a range.
Yeah.
It could be lower, it could be higher.
Okay.
And so those prodromal symptoms can be really mild, or they can be more typical of like a respiratory infection. So the height of the fever doesn't really help clue in why that fever is there and whether it's measles.
I have another question, if that's okay.
Yeah.
Can someone who, let's say an adult who's been vaccinated and is traveling abroad, somehow carry the virus home or not? Are there carriers that are people that are immune to this?
Typically, if you're vaccinated against measles, no, you shouldn't be able to carry it and pass it on to others.
Okay, good.
I see some questions in the chat, so I'll go through them and try and answer them. Tammy Davis asks, should all healthcare providers born after 1957 get their titers checked? That's not currently recommended. Typically, if you've gotten your 2 doses of MMR vaccine, you're considered immune. Some hospitals and healthcare organizations will require titer checks as conditions of employment. So you might get them checked that way, but it's not currently universally recommended that healthcare providers or other individuals in high-risk professions get their titers checked. Does that answer your question, Tammy? Yes, fantastic. Jan Markowitz asks, what is the current vaccination rate in Baltimore County and by specific location? Are there areas with less than 95% vaccination rate? What is the current status of exemptions, religious, medical, or personal? I don't know the exact number, and Dr. Wilson may be able to speak more to that than me. My understanding is that vaccination rates in Baltimore County across the board are very good. I think we're over 93%, maybe over 95%, pretty much across the county, and that includes in the public school system. I'm not sure what the current state of religious, medical, personal exemptions are.
Yeah, so in general, the rate is high. There could be areas with lower vaccination rates, but what our program is doing is identifying both in public and private school systems for those back to school vaccinations, and then targeting catch-up clinics prior to the start of the school season. So if there are areas or populations with lower rates, we are working to target our messaging and availability of the vaccination, including having pop-up clinics, having a mobile van with clinics. So really working. In general, we've got really good vaccination rates in Baltimore County.
And then Geraldine Day asks, are children with asthma or other respiratory conditions more at risk for pneumonia if they contracted measles? Yes. Anyone with underlying lung disease is at greater risk for respiratory complications. And then Faraz asks, after 2000, did we continue to vaccinate children, or did we stop MMR vaccines? We did not stop. MMR vaccines are still routinely administered as part of childhood vaccinations. So that still continues to this day. And then Sue Murphy asks, what test, oh, sorry, Dr. Wilson.
Well, I think what Faraz is getting at is why are we having a big outbreak now? And so my answer to that would be that in the community or the region in West Texas where this big outbreak started, there were vaccination rates that were lower than 95%. So it was a population where those rates were under that 95%, under that 93%. And so, like we said, it's just, if you're not vaccinated, it's just so contagious. And so it just spread really quickly in that community, especially, among kids who are interacting and all of that. And so it's remarkably good at finding people who aren't vaccinated. So if you have a region or a population where it's under that sort of herd immunity of 93 to 95%, that's when you see it come back at these high rates. We always see some travel associated measles in the US, but these outbreaks we see when it hits a pocket of under vaccinated people.
Yeah. And then Sue Murphy asks, what testing is there for those who have been exposed? There are tests. If you think you've been exposed, your healthcare provider can certainly order that for you. It's the most common test is a swab, so nose and throat, kind of similar to COVID, which I know is everybody's favorite thing. There is a urine test available as well, although it's not as accurate as the nasal and the throat swab. But if you go and your doctor hands you a urine cup, they're not crazy. There is a test for that. But again, Dr. Wilson.
Well, I didn't mean to interrupt. I just wanted to talk next. Yeah. And my comment is that if you think you've been exposed to measles, especially if you have symptoms, you should call your doctor's office before you go in, because there's terrible stories of people who went in because they weren't feeling well or thought they had measles, and then, like we said, it stays suspended in the air for up to 2 hours after, and other people, especially kids under 12 months old who aren't vaccinated, then contracted it. So if you think you are exposed, especially if you think you're exposed and you have symptoms, call, and your doctor's office will make arrangements to get you testing where it's not putting anyone else at risk. They might have you come at the end of the day and put you in a room where no one else could get exposed. They might tell you to go somewhere else where they can do the testing. So just an important message about prevention.
Yeah, and similarly, if you go to the emergency room, please also call them and let them know as well for many of the same reasons. ERs do have numbers associated with them. You can Google them. A lot of times, if you call and say, "Hey, I'm coming in. I'm concerned I might have measles," the ER is a chaotic place, but they will also do their best to try and accommodate you and limit your exposure to other people if you have that concern. And then Faraz asked, do titers decrease? And as an adult, is it recommended to get a vaccine? My understanding is that titers do not decrease as we age. Once you have the immunity, it lasts a lifetime. And currently, it's not recommended that adults get a booster dose if they've gotten their 2 doses as children.
This is Jan again. Is Immunet still available to use to track immunization levels? Or I thought I had heard Immunet might have been stopped.
Yeah, I think the state, and Dr. Wilson would know more, I think probably know more than me, but I think the state has suspended Immunet for now. I see Dr. Wilson unmuting though to probably.
Yeah, so Immunet still exists. So Immunet, for anyone who isn't savvy about Immunet, is it's just an online registry for public health and clinicians to keep track of vaccines. So it's just immunization records. But right now, they've suspended the ability for people to look on Immunet, the public to look on Immunet and get their immunization records. But all that information is still in Immunet. So it's just that currently people can't personally go into Immunet and look up their kids' vaccine schedule or vaccine receipt that they've had.
Yeah. Thank you, Dr. Wilson. Tammy Davis asked, if adults with a history of 2 shots are going to travel, should they get a booster? Can they get a titer and booster if the titer is low? And what is considered an adequate titer? So again, if you've gotten your 2 shots as a child and you're going abroad, there's currently no recommendation that you need a booster before you go abroad. Again, it's generally accepted that you have adequate immunity from those 2 shots given their proven effectiveness. You can always get a titer checked if you're concerned, if you're worried, if you want that peace of mind. If it's low, then yes, they would, or if it's low or not detected, then yes, they would recommend getting a booster shot at that point. I'm not sure what's considered an adequate titer. Different labs report it differently, but your physician would be able to kind of advise you on that. And then Faraz asks, if adults haven't got vaccinated, but think they had measles as a child and are not sure, should they consider getting the vaccine? You certainly could. You could also get your titer checked to see if you have that immunity before undergoing the 2-shot series. And again, that's probably a conversation to have with your personal physician. And then someone asked, can measles mutate the way COVID has? To my knowledge, the measles virus has not significantly mutated. I'm not aware of any measles mutations. I guess theoretically in the way that any virus could, but I'm not aware of any mutations that measles has undergone in the time that it's been around and recognized.
Yeah, and the vaccine has not had to be modified. For example, we know the COVID vaccine was updated multiple times because of mutations. The vaccine has stayed just highly effective for decades for measles.
Any other questions?
If you have further questions, maybe we can put in the chat the best number to contact if additional questions arise. I don't know if one of our health department people are on this call could put the preferred contact information. Additionally, on our social media sites, oh, here we go. A phone number is 410-887-6011. That's 410-887-6011. Also, we have information on our website, also on our social media site. We have posted this information about this conference, and we will have the slides available. And also don't forget that there's a measles clinic tomorrow, and that information is also on our Facebook page for Department of Health and Human Services and on our website, I believe. Thanks, everybody, and thanks for these great questions. Thank you, Dr. Dasani, for your presentation.
All right. Thank you, Dr. Wilson, for being a fantastic moderator and helping flesh out some of my answers to these questions. Much appreciated.
Excellent.
Have a good night, everyone.
Everyone, have a great night.